Good afternoon, everyone, and welcome to the MDPCP Primary Care Staff Training Academy. I'm your host, Angelica Ortman, and I'll be assisting throughout the afternoon with the training. And first, I want to thank all of you for attending this webinar. Our presenters have put together some great training content, and we hope that you enjoy it. Before we officially get started with the training sessions, there are a couple of things that I want to go over with you. So first, the training will be recorded. And on your screen, you should see a GoToWebinar control panel. And I want to point out some of the control panel features that you'll be able to use throughout this training. So all the training materials can be found under the handouts section. There are 3 documents that have been uploaded. We have the curriculum, which shows the agenda, the presenter, the learning objectives for each of the training sessions. We have handouts that the presenters will be referencing throughout the training, and then also the PowerPoint presentation that's currently being shared that you can download from the handout section. If there are any issues, and hopefully you don't have any issues downloading the materials, they are also posted on Connect, so you'll be able to access the materials there as well. Another feature that is on the control panel that's available to you is the questions or chat box. So we'll address questions at the end of all of the training sessions. So if you do have any questions throughout the training sessions, please use that chat box or question box, and we'll address those questions during the Q&A at the end of the training sessions. Another thing to bring to your attention is that the training activity has been approved by MedChi for 3.5 credits that you can apply for if you are interested. After the training, you'll receive a follow-up email with the instructions and also a link to apply for their credits. For the non-physicians, you guys can apply as well, and you'll receive an attendance certificate. And then you'll just want to check with your accrediting or credentialing organization to make sure that they do accept the CME credits. Most all of the accrediting and credentialing organizations do accept the CME credits to one extent or another, so you just want to make sure that you do contact them and get that approval. Also, in the follow-up email, there will be a post survey that's included, so you'll also see that at the end of the webinar as well. It's only about 6 questions, so please take some time to fill that out. The survey is going to help us understand if the content that's being delivered today is helpful, and we also want to know what you would like to see in future trainings as well. So for this training that we have this afternoon, we have about 5 sessions that will be covered. So the first session will be covering an overview on the MDPCP program. The second session will be covering 3 topics around dealing with change, team-based care, and also quality improvement. For the third session, we'll be covering the patient journey before, during, and after the visit. For the fourth session, we'll be covering social determinants of health and patient engagement. And then the last session, we'll be covering population health management analytics and showing an example of that topic. So before we officially kick off the first training session, I would like to introduce our awesome presenters. So again, I'm your host, Angelica Ortman, and I have about 13 years of experience in the healthcare industry. I'm an executive consultant in population health management with Medical Links. And some of my key areas of expertise include quality improvement programs and methods, practice transformation, healthcare payer experience, and also program management. I hold a double master's in healthcare and business administration and currently pursuing a PhD in community health. Our first presenter is Dr. Howard Haft. He has 27 years of clinical experience in primary internal medicine and 10 years of hospital-based emergency medicine, clinical and leadership experience. He was founder, president, and medical director of Maryland Healthcare Associates, where he established a multi-specialty medical practice. Additionally, he also was founder and president of the Maryland Foundation for Quality Healthcare, which provided healthcare education to uninsured and underinsured Marylanders. Dr. Haft served as Chief Medical Officer at Health Partners, a Waldorf-based charitable clinic serving Charles County and surrounding areas. In 2015, Dr. Haft was appointed as the Deputy Secretary of Public Health at Maryland Department of Health, and currently Dr. Haft serves as the Executive Director of the Maryland Primary Care Program, providing leadership and overseeing the day-to-day operations of the program. Our next presenter is Dr. Nkem Okeke. Dr. Okeke is a Kaizen-spirited healthcare executive with 20 years of experience in primary care and patient-centered care redesign. In the last 10 years, she has led and supported several primary care transformation and population health initiatives, which focus on provider engagement, quality improvement, and payment reform. She served as the National Learning System Faculty Lead for Comprehensive Primary Program, also known as CPC Plus, at Booz Allen. She served as a Special Project Director for Population Health Initiatives for Priority Partners at Johns Hopkins Healthcare. And before that, she served as the Regional Telemedicine Coordinator at Kaiser Permanente. She is the founder and Chief Executive Officer of Medical Links, a healthcare advisory and population health management firm located here in Maryland. Her passion is to better integrate healthcare delivery systems. Our next presenter is Yayo Kamara. She is a Senior Clinical Coordinator with Medical Links. Ms. Kamara began her career as registered nurse and has over 8 years of experience in nursing. She holds an MBA and a Master's of Science in Nursing from Marymount University. Ms. Kamara is not only a nurse at heart, but a nurse practitioner with a strong background in primary care, urgent care, and also care management. The next presenter is Ashley Johnson. Ashley is a community health worker supervisor with a background in behavioral health. She has 12 years of healthcare experience with an emphasis on mental health and substance abuse. Ashley supervises a team of 12 community health workers aimed at identifying barriers to care and eliminating social determinants due to lack of community resources and support. Ashley is currently pursuing a master's in social work and has a passion for improving healthcare disparities. So our last presenter is Charlene Cho. She is a senior associate and clinical data analyst at Medical Links. Charlene has a background in neuroscience and economics and holds experience in hospital settings in quantitative and qualitative research, and also as an EMT. In the past few years, she served various roles in the faculty learning and dissemination work streams for Comprehensive Primary Care Plus. She also works as an emergency department clinical information manager. Charlene is passionate about improving access and quality of care for those who face healthcare disparities, so that fewer people have to choose between making a living and their own health. So those are our awesome presenters we have for today's training session. One last thing to note about all of the presenters here, they have no disclosures directly related to the presentation that's being delivered to you today. So that concludes the opening remarks. So without further ado, I am going to turn it over to Dr. Howard Haft for the first training session.
Thank you very much, Ms. Ortman. Those wonderful introductions, and it is my great pleasure to be here, my friends and colleagues, presenting to you and talking about the overview of the Maryland Primary Care Program. We'll go on to the next slide. So the training design for this particular segment is designed for program year 2 practice staff. That means that you all have been in this program for a full year, and you've had the full joy and experience of seeing this new baby be born. With all of the excitement of that and all of the also frustrations as we work through the nuances of an absolutely unique program with so many new features. So I want to start by thanking you for your participation, for your patience as we work through many, many things that were new for us and new for you. And say that this training is really specific for you, although many of the aspects of the training that we do is general training for advanced primary care. So it cuts more broadly than just the MDPCP program. But you are a very special group as being the inaugural group, and you will always be remembered exactly that way. So the presentation today also is going to be focused on staff. We also have a separate set of presentations and academies that we use for the providers and the practitioners. But they may also, if they're joined in with us today, they may also benefit from a lot of the same material that's here. It cuts across, much of it cuts across all types of care, provider, and in all specialties. So we'll go on to the next slide. So even more than thanking you for being a first-year participant, the second year that you're in now has been an even more unique year than the first year in so many ways. And you really are the real healthcare heroes in my mind and in the mind of many others, in a different way, that we celebrate a lot of the real drama that goes on in the life and death things in intensive care units with people on ventilators, but you're doing things at the preventative level, at the ground level, with far fewer resources, and without a real script to go by for many cases. And some of these pictures here are pictures from your practices of people doing testing out in a tent outside of an office, or using PPE to examine somebody in an office, or doing telemedicine. It's remarkable how you've adapted. I can't thank you enough for that. And I know that the citizens and all of Marylanders are thankful for your healthcare heroics. Next slide, please. So overall, there's kind of a bigger theme to this. It's always about why we do things that really drives us forward through these difficult times. The what we do, and we'll talk about a lot of the what's that we do during the course of this presentation, they're all important. It's important we get them right. But it's really important about why we're doing it, because if we don't understand why we're doing it, the what becomes unimportant to us, or relatively less important. And I love this quote from John F. Kennedy. He gave it to the graduating class at Rice University in 1962. Of course, it was a different time, and he was planning on doing something really dramatic, going to the moon. And he said, and at that time, they really didn't have a way to go to the moon, but he said, we're going to do this, and we're going to do this in this decade. He didn't get to live to see that, sadly. But we did, as you know, go to the moon. And this is what inspired us in many ways to do that. He said, we're not doing this because it's easy. We're doing it because it is hard. And the goal will serve to organize and measure the best of our energies and skills, because that challenge is one that we're willing to accept and unwilling to postpone, and one we intend to win. Doesn't that sound an awful lot like the challenge that we have now before us with COVID? In the same way, we're going to get past this, and we're going to get better, and we intend to win. Next slide, please. So in COVID-19, the primary care providers really have become the front line. There's no one better who has been able to identify high-risk patients, and you know that because you get the data for those patients, whether it's your preventable avoidable hospitalizations, or the high risk because of multiple admissions, or any of those other tools that you get on a regular basis in your dashboards. They've uniquely allowed us in this program to identify those high-risk patients, and you reached out to them through telemedicine and phone calls and other kinds of things to tell those high-risk patients to stay out of harm's way, because those are the ones who really are at high risk from this COVID. It's not the young, healthy for most part. It's the elderly and those who have multiple comorbid conditions, and that's who we serve. And also the messages that we give to those patients, your messages, no one can give that better than you can. We can do public service announcements and put it on billboards and stay out of trouble and stay away from the virus. That means something to people, and over time it will mean something, but it really is not the same as when you call someone and as their provider, as a trusted provider, and you say, I really think you ought to stay home. That really means something. That really connects to people. So in your role in this epidemic will continue to evolve. You've done testing. We're shifting testing to the community now, but there'll still be testing and evaluating the test results. There's been volunteering going on, and now we'll have contact tracing, which will even add new layers of interest and complexity to what we're doing. But you're up for the job. Next slide. So why don't we just show you a little quick inspirational video that talks about our healthcare heroes.
Thank you. It's something we say all the time. Mostly, it's a response to something small. A door held open, a compliment, It's just something we say often without much thought. But now, maybe more than ever, we're all thinking about what we're thankful for. While many of us, hopefully most of us, stay home to flatten the curve of COVID-19, there are others who show up every day on the front lines. Nurses, doctors, healthcare providers, and the people who support them. People who risk their own safety to help us all. We are all showing them how much we care. Scratched in chalk on the sidewalk outside of a hospital, held up high on a poster, even written on the back of a pizza box. But there are more ways that we can show our thanks. We can thank them by continuing to stay home and flatten the curve. We can thank them by recognizing that, even though it's hard for all of us, it's hard for them too. Thanks, Health Heroes, because that's exactly what you all are. Heroes.
Thank you. Let's go on to the next slide. So you'll all be able to tell your children, your grandchildren that you served and all the things that you did during this really remarkable time that characterizes our generation. So why are we embarking on this transformative journey? There's a lot of reasons behind the Maryland Primary Care Program. But most important is we want to provide the best healthcare we can for all the people we serve. We've been caught in this ever-increasing volume demand, and we wanted to shift from just producing volume to bringing real value to the healthcare delivery system, and to keep people out from unnecessarily having to go to an emergency department and hospital visits, and also, unbeknown to us when we started, to be better prepared for public health crises like COVID-19, and most of all, because this is what we signed up for. This is our calling. Next slide. So this is just, I'm going to go through just a general overview now. You probably have seen this 100 times, but I'm going to just recap the important elements of Maryland Primary Care Program and then turn it over to our subsequent presenters. As you recall, the Maryland Primary Care Program is part of a larger statewide program, which includes work that's being done in the hospitals for them to reduce the total cost of care, Part A and Part B, by reducing hospital admissions and ED admissions and creating healthier populations. And they're pledged to reduce that run rate by $300 million by 2023. I think we've already hit that target. And so we're well on the way for that. And then we're also intending the state to improve the health of the population in general ways. We've targeted reducing the incidence of diabetes for the first year or years, and we have a large diabetes prevention program across the state, and you'll be contributing if you have not already to that. And then the primary care program, Maryland Primary Care Program, is this unique voluntary program that underpins the entire transformation. Now let's talk about what's in that program. Next slide. So what's in that program right now is beginning in year 2, we already have 476 primary care practices with more than 2,000 providers, more than 350,000 fee-for-service beneficiaries, and somewhere between 2.7 and 3.8 million Marylanders that we serve every day. That's more than half the state. That's pretty impressive, y'all, for a new program. And we now are in an open enrollment for the 3rd year beginners, and I think we'll see a brisk enrollment for that. So you're in good company, and you're covering the state from north to south and east to west. Next slide. And here are the basic elements that make up advanced primary care, and I'll just walk through them quickly because you've seen these before. First is access and continuity. That's expanded access and alternative visits. And in the last several months, that certainly has included telemedicine and telehealth as part of that expanded access. Care management, the fact that you're all doing some version of risk stratified care management and doing that important transitional care management when people leave the hospital or the emergency department. Additionally, comprehensiveness and coordination of care. You've added behavioral health and integrated that into pretty much every one of our bricks and mortar sites. Advanced medication management, and you're attending to the social determinants of health for people. Those things that typically were and previously were not really included in the things that we do in a primary care office. We just took care of the regular medical problems. If you had a problem with transportation or housing or food insecurity, or were at risk in some way, bodily risk from violence, those weren't necessarily included as a routine thing that we did. But we said those are really important, and you've stood up and done that, done your patient family advisory councils. And most of all, you're being really data driven. The things that you do, in addition to the intuition, which is great, it's also driven by data. And those are the kind of the 5 components of advanced primary care. Next slide. So recap of the year 1, what we've seen now in the rear view mirror is we did performance quality measures, and you recall that there were diabetes and hypertension, and we went through the process of uploading them. And then because of COVID-19, we said, well, yes, it's good that we did that, but it's so hard to do all of this other administrative things right at the moment that we're going to take our foot off the gas. If you've uploaded them, that's great. If you haven't, that's also good. And we're also going to say that we're not going to hold it against you if you did or didn't do those uploads, that your performance bonuses will still be there for you. Also, care management. We provided longitudinal care management for at least 5% of all the attributed beneficiaries, so of the high-risk beneficiaries. So that's a big deal. And then planned care for health outcomes, we improved the CRISP data resources. We added the Prevent Avoidable Hospitalization tool, the COVID test orders that you all can do ordering tests right from your office now, and now the COVID risk scores also. So it's really been a remarkable year. Next slide. These are the requirements that probably are too small print for most of you to read. So we're not going to go through all of those, but just to say that right now, many practices are in Track 2. I think we have more than 120 in Track 2, but ultimately, all practices will move to Track 2 in order to stay in the program. And this is just a way for you to visualize what it takes to move to Track 2. You have to complete all of the Track 1 requirements and then show that you're ready to do some of the Track 2 things, and they're highlighted here. We can go into that more. We will go into it more in separate webinars. But just to let you know, that's the transition that you'll all, if you're not in Track 2 now, you'll be making that transition. So there's some more great challenges and great new things to look forward to ahead. Next slide. Planned care for health outcomes was really a big deal recently. We released a lot of these individual data about COVID risk, which is certainly planned care for health outcomes. And there we were able to identify with, and this is just a map where you actually got a score in your dashboards attached to the Prevent Avoidable Hospital Event tool. But this is the map that drove that. And this map gives an indication, and this is for, I believe, Baltimore City, where each of those dots is where a high-risk individual lives. So we use that in public health also for being able to produce resources in geographic areas. You use it in your practices to understand at a patient level who is at high risk and specifically reach out to them to give them resources or get them tested or whatever is necessary. Just a dramatic improvement and a nuance that came about only because you were already here and ready to accept it. Thank you for being there. Next slide. So we'll continue to provide ongoing practice support. Many of your practices are aligned with care transformation organizations. They do an incredible amount of help with staffing and technical assistance and other things. CRISP has been weighed in as an invaluable tool. We couldn't do without what they give us in terms of data, event notifications. I'll go through some of those things in a subsequent slide. We have the MDPCP learning system, which is jointly run both by the state and by CMMI, the Center for Medicare and Medicaid Innovation, which has the Connect site and webinars. As you know, we have webinars pretty much every day of the week now, in addition to face-to-face meetings when we when we're permitted to have face-to-face meetings. We've had Mosaic expert implementation coaches. We've had technical assistants and contractors for coding and billing and for EMR optimization. And we have our great team of PMO, Program Management Office coaches, who every practice has one of those attached to them. And they provide you at your elbow assistance. Next slide. Care transformation organizations do all of these things. And an example of personnel that they can and will provide include care managers, pharmacists, LCSWs, community health workers, and others, and a whole host of these services for care coordination and data analytics and assistance meeting care transformation organizations. And they are at your beck and call. You hire them to help you, and they do a great job of doing exactly that. Next slide. So here's just a short list of some of the tools that we get from CRISP: the COVID ordering ability, the PDMP for drug monitoring, encounter notification to let you know when your patients go into or out of the hospital, the emergency department, the query portal to look up patients' results and get their summaries, direct secure messaging, the prevent avoidable hospital event tool, care alerts, which are really, really important. I want you to continue to put those in as quickly and as many as you think you need to. And the MDPCP reports and the ECQM reporting. So that's and every day, CRISP comes up with a new tool that you can use that makes your life easier. It makes it more easy to visualize the needs of your patients. Next slide. And then the learning system has all of these features: the coaches, the webinars, the training academies like today, office hours, online manuals, collaborative communities like Connect, and then things within Connect that even smaller groups of collaborative communities, and annual face-to-face meetings. And I pledge to you, we will get back to those again, and reporting. So this is just one of many experiences to make it easy for you to go through this transformative process. Next slide. I think that actually is the end of my presentation. I'll stop here and just thank you for everything you do. And God bless you and your families. And I hope that this Memorial Day weekend, you get some time to get some good rest and relaxation.